Hey, it's Aaliyah, and I am back with another conversation. First, I just want to say, please do not come for me, all my viewers who are, watching faithfully Daily Conversations podcast. Do not come for me in my head and like the way that I look. This is like complete mom life, like going from one event to the next event, like still trying to balance being a mom and being creative and doing what I like to do. So, I'm going to show up, as I am. And hopefully you all like that and enjoy that. But please don't come for me in the comments, okay? Now, let's get into our real conversation. Again, Daily Conversations is a podcast to inspire and educate you to go out there and make a change or to go out there and follow your dreams, right? Because everyone has a story, and I love to share people's stories so that we can kind of figure out how to get there, right? We're trying to inspire and educate you to get to where you need to go. So I love to focus on creatives, educators, entrepreneurs, and today I have a special guest, and I would love for you to introduce yourself. Tell us who you are, something interesting about yourself, and what you do.
Hey y'all. So my name is Tasha. Actually Natasha Ramsey. Some people call me Dr. Tasha, but I usually go by Tasha. I am the founder of Gorjus which is a sexual health education organization. My 9 to 5 in my regular job is being a pediatrician. And I'm actually also an adolescent medicine specialist, which means I take care of people who are ages 11 to 25 and anything that's like specific to what a teenager or a young adult might need. And then even more specifically, I work in a school. So I work in a school-based clinic. I work in a high school, which is super cool because I'm right where the kids are. Anytime they need anything, they can come right to me. They know that I'm always there. So it's a great experience. But my 5 to 9, like I mentioned already, is Gorgeous Stock. I also call it Gorjus Sex Ed because most of what I do through my business is create sexual health resources. I draw my own resources and then I take those drawings and then make handouts, presentations. I give presentations. I work all over the United States, but I'm based in New York, but I'm from Jersey and my family's from Jamaica.
Okay, I
So I
love
do
it.
some work in the Caribbean. I do some work in Africa. So it's just been like a really great experience. And I literally married like all of my joys together to form Gorgeous Doc. My joy of art, my joy of health education, teaching, Blackness, like all together into one. So
Mm. We got a doctor on the show, y'all. First of all, that's amazing in itself. Then you're a creative and all the things, beautiful. Like, wow. I just wow. Like, I love that. Could you please like walk us through your journey? How did you get into the
Yes.
medical field?
Yeah, so my first love was always writing and drawing. I had a journal all the way from like maybe second grade. I started writing in like a journal and documenting like my experiences. So I've always was interested in writing and journalism. And then my father paints, so he taught me how to paint, he taught me how to draw, and so I would always paint and draw. So I always had this like creative side of my brain, but I was also a nerd. Like I'm talking about carry a big book bag like a turtle, like nerd, like book bag was heavier than me sometimes, nerd. So I really liked science and math and like all those topics as well. But there was always this creative side of my brain that just I felt like was like the part of my brain that I really love to nurture. So when I was in high school, I went to a science high school. My mom actually works in the healthcare fields and she made me go to that high school. I didn't want to go there. But like I said, my parents are Jamaican. So she was like, I don't care what you want. So she made me go to this science high school and they were kind of like pushing health sciences on us and like the health field on us. But at the time I was very resistant. I was like, no, I'm not doing that. I'm gonna be a journalist. I'm gonna be a writer. Like I'm gonna travel the world and like hear people's stories. Like I don't want to work in a hospital. Yuck. Why would I want to do that? So um, but someone knew that I love to write and they found out about this teen magazine that was looking for writers. They were looking for journalists, like people, not journalists, but they were looking for people to write on their newsletter and on their website. And the organization was called Sex Etc. So they did a lot of work around sexual health, educating teens and young people about sexual health. And their motto was like for teens by teens, like honest information. So I started writing for that teen magazine and I started learning more about sexual health. I started learning more about disparities in sexual health and how there was like things that were impacting Black youth or Hispanic youth differently, or depending on where you live, you got different sex ed and there was different laws. And I was enraged. I was like, this is not right. We got to do something about this. So then in college, I majored in public health. That was like my first kind of like introduction to public health. So in college, I majored in public health. And for public health, you have to take a lot of the same pre-med classes. So I was taking some of the same pre-med classes, and I was doing well in those classes. And I had another mentor who was like, God spoke to me and told me you want to be a doctor. His name is Dr. Khan. Shout out to Dr. Khan. I went to Rutgers University and I was in a program called ODASIS, the Office for Diversity and Success in the Sciences, which basically helped people who are underrepresented in medicine with like books and tutoring and other support. And basically, they just like wrapped this like support and love around me and just pushed me. And I didn't think I hadn't thought that far. I wasn't like, oh, I'm gonna be a doctor. I knew this my whole life. I literally was like, I'm not doing that. Like, I'm gonna be in the streets with the people. Like, I was like, I don't know. So through that mentorship, and I had friends who were also going into medical school, and so we pushed each other, we held each other accountable. Shout out to my friend Jennifer. Um, and it just kind of unfolded like that. And as I learned more about what I could do as a physician and as a doctor and what I could do in public health, I knew that I needed to do both. I was like, I need to be like the best, like public health is almost like the coach, and then the players are like the doctors, right? Like the public health piece like gives me the overview of what's going on, why things are happening the way they're happening, how we could fix like the underlying root, the underlying cause of something. And then as a physician, like you're on the ground, like seeing each individual person and hearing individual stories. So the combination of the two, and also people respect the MD. So that clout to be able to say, I am a pediatrician and this is what I'm recommending, it goes a long way. So I knew that I wanted that combination. And because of my interest in sexual health from when I was a teenager, I knew I wanted to work specifically with teens. I knew I wanted to work in the area of sexual health and the area of reproductive justice. And so that's how it all happened. And that was a long answer. But long story short, I didn't know. And it just kind of unfolded like that.
Wow, I love that. I think that that's super beautiful. You find people who encourage you and support you to grow.
Yes.
I
Yeah.
mean, wow.
That was the story of my life. Like people saw me and they were just like, there's something special there. Like I'm gonna push her. And like every step of my journey, there were people pushing me and supporting me and holding me up and my community. Like I'm from Jersey, I'm from New Brunswick. And like I said, I go home now and people are still like, hey, what's up, Doc? Like everybody knows me. They watched me like, like struggle to get through it, So that sense of community is really important for sure.
Well, you're a doctor now, right? Like you went
Yes.
through your journey, you're a doctor now. You work with teens, which I think is very beautiful, and you work in school.
Yeah.
I've never seen a sexual education doctor in school. Like I'm an educator and I used to work as a public educator. I've never seen your role in my like in a school that I worked in. Can you tell us
Yes.
like what your role is and what do you do?
Yes. So the way that it works is that I work for a medical institution. So in New York City, they have the Office of School Health. It's a joint office between the Department of Education and the Department of Health. And they
Mhm.
put this money together and then they distribute that money to different organizations to then offer medical services in schools. So I work for a particular organization. They have schools and they have clinics and schools all throughout New York City, and I'm hired through them. So I
Mhm.
work for that institution, and I do basically the same thing that a doctor would do in an outside clinic. So we do physicals, we do vaccines, we do a ton of reproductive health, we do, birth control, pregnancy testing, we do long-acting reversible contraceptions like IUDs, Nexplanons, yep, all in school. We do mental health, so they get therapy in school. If they need medications, like if they say they're like depressed and they need like a antidepressant, we can also start them on that. We have dental services. We do everything because the reason why school health really started in New York. New York was one of the major places that school health started. There was a major crisis with teen pregnancy, particularly in the Bronx. And so
Mm,
they were like, in order to kind of combat that, let's put more access to reproductive health in the schools. So
mm,
they started putting these reproductive health clinics in the schools. And then they realized, like, oh, if we're going to give them reproductive health, there's other stuff that they need. Like, let's offer them other stuff. So then they started expanding what they started offering. And then people started to replicate that model. So it's not everywhere. There's some places where they don't have it at all. Like
mm.
Philadelphia doesn't have it. There's certain states where it's just not a thing, but there's lots of them in New York. There's like over 50 of them in New York, maybe even like 100. There's lots of them in California. So it really depends on like what state you're in and what city.
That's amazing because, like I said, we don't have that in North Carolina. Like
Yeah.
we have school nurses, but they don't do the whole nine. And then when it comes to sexual education, I remember my PE teacher, like our health teachers, taught us stuff like that.
Yeah, so the thing is, as my role as my full-time job, I do sex ed in the one-on-one patient visit, but I don't get to go into the school and do education. I do that on the side. So, but it obviously it marries well with what I do full time because my full time job, I'm seeing kids come into the clinic and be like, "Can I use two condoms? Is that okay?" And I'm like, "No." I'm like, I thought that myth was already like, and when you think that things are like already understood and known, like you get a new batch of kids that have no idea. So there's always work to do. So yeah, I do a lot of one-on-one sex education in my clinic, but the work that I do for my business is completely separate and in other spaces. So the kids I work with get the benefit of me having that knowledge and like make throwing that extra. I always tell them, you're gonna learn something today before you leave this clinic.
I love that. Listen, the kids, they have to learn, they have to know. And
Yeah,
so, since you kind of already brought it up, let's go ahead and talk about it and get into it because I met you through 4.0. So you are
yeah.
like, you're building your business, you're a founder just like me, and I would love to hear more about your business and what your business is and just like give us the whole spiel.
Yes, yes, yes. So, like I had mentioned, Gorgeous. So it's Gorgeous Doc. So that nickname actually came from when I was in middle school, back when people used to like draw like little doodles and things, right? Like, cutie and hottie and all that. So I was like, I need to come up with a name, and I had to misspell it, obviously. So Gorgeous, Gorjus. And so I would doodle that all over my notebooks. And then when social media came out, I was like, that's obviously going to be my handle. So then it became my handle. And then when I became a doctor, I was like, oh, I'm just put doc on the end. So it kind of started like that. And like I said, I used to journal when I was a kid. So then I started blogging and blogging about my experiences as a Black woman in medicine and blogging about what my journey was like. But I felt like there was a disconnect. I'm like, I'm just like talking about myself and like what's going on. But like in the background, I'm like super passionate about sexual health and doing like all this programming and all this cool stuff, creating curriculums. And so one day I literally was just like, oh, I should just use my platforms to do sex ed. So I literally pivoted and started doing some social media stuff on around sex ed. And then the pandemic happens, and everyone was talking about COVID. Everyone was like, freaking out about that, but nobody was talking about sex. And the kids were still having sex. Okay. And the clinics were closed. STI testing wasn't happening. People were getting pregnant. There was all this stuff going on. So I'm like, we still need to talk about this. So I started doing more outreach and more social media stuff around it at that time. And then I started drawing my own images because I couldn't find what I was looking for. Because I forgot to mention, I was an Africana Studies minor in college. So and my parents are Rasta. Like I said, I'm Jamaican. So I was always pro-Black, always like, that was always a very important piece that I always like, was important to me. So as I was creating these materials and creating these like resources on social media, I'm like, well, let's look at the intersection between race and gender and cervical cancer. And let's look at the intersection between this and that. And I couldn't find images that I liked. So I was like, let me start drawing my own images. So I started drawing different skin tones. I started drawing different body shapes, more gender inclusive language. And people were like, where you get those from? And I was like, I made them. And they were like, can I buy them? And I was like, okay. And then people were like, do you do presentations? Do you do? And people just started asking me for stuff. And I was like, yeah, sure. So it literally started to unfold in that way. So now Gorjus Sex Ed as it stands is a organization that creates beautiful, medically accurate, culturally competent, reproductive justice centered resources for young people and the people who serve them. So that is my business and I love it so much. And it's been 5 years because I started it. I literally bought my LLC with that stimulus check that they gave us. So it's been 5 years. It was 5 years in April. So yeah.
Well, congratulations to 5 years in business. I wanna talk about that, but I also want to just get into sex ed. Like I want to talk more about that too. So how about we just let's just talk about sex ed because I think that that's so important. Like you said, kids are having sex,
They
and
are.
for some reason it feels so uncomfortable to talk about it and to like. And now I'm a parent and I'm a girl mom too.
Of
So I
course, it's
feel like
scary.
I need to like, figure out a way for me to be more comfortable because the uncomfortableness was passed down from generation to generation, right? My mom was uncomfortable to talk about sex.
Right.
Grandma, like everybody just so uncomfortable. So my question to you is many young people feel comfortable about talking about sexual health. How can parents and educators create a safe space to have these conversations?
Yeah, so I think what you said just now is super important. We all bring our own like experiences and biases to the table. And before talking to a young person, you want to try and manage those. So if possible, you want to check in with yourself about those biases and then also learn, right? Do your own research so that you feel comfortable even being able to have that conversation with your kid or with a child or with a student. So that's what I always recommend is like checking your own bias first. And I've had to do that too. And making sure that you're equipped before you have that conversation. And also admitting that you don't know everything, right? Your kid may ask you something or a student may ask you something. You're like, actually, I've never heard that term before. I'm actually not sure, but I'm going to look it up and I'll get back to you. I think the other important thing is sexuality is a normal part of human development. It's a normal part of adolescent development. Most people by the age of like 26 have had sex, like 99%, something like that. There's like a small percentage of people who have, yeah, there's like a graph and it literally goes like this. And then it like, most people by the age of me, I think it was Guttmacher Institute has a really nice chart where they show it. So most people in their 20s are going to have sex. There it has been a decline. So what we've seen is that people are waiting longer to have sex than in past years. So a lot of people are like, oh, these teens are having sex so soon, more than us. They're doing more than us. And actually the data shows the opposite. Like
Oh,
back
that's
in
good.
the day, yes, exactly. So back in the day, there was actually more teens that were sexually active. So these teens are choosing to wait longer. But at some point they will. So they still need that information so that they can be prepared. So I think the best thing that you could do is when you're talking to teens and young people about this is acknowledge that this is not something you may be doing right now, but this is something that may come up later. So I want to make sure you're prepared. So let's talk about a few things. They might be like, oh, and you're just, they still hear you. They are still listening. I promise you, they still hear you. So you still talk to them. You don't have to like force it down their throat, but just in little pieces. Maybe you're watching a movie for parents. You're watching a movie together and something comes up. And you're like, what did you think about that? And then you use that as a conversational piece instead of like, let's sit down and go through anatomy, like use movies or other like real world examples to like talk about things. And then you also say, if something ever comes up, I want you to know that you can always come to me. You can talk to me. And if you don't feel comfortable talking to me, you can also talk to Auntie Tasha or Auntie whoever or Uncle blah blah blah, whatever other trusted adult they may have in their life. They should know that they should reach out to them about that. And then the other thing, one last piece about this is that sex ed actually starts from the very beginning, right? A lot of times people think like, oh, I'm gonna wait until she has her period, and then we're going to talk about it. Sex ed is not just sex. Sex education is consent, boundaries, puberty, menstruation, all of these relationships, communication, all of that is important. So a 5-year-old should know that they have a penis. They should know that. They should know the word for it. Because then also they could say, okay,
Mhm.
this is a place that other people should not be touching without my consent. They need that language to be able to advocate for themselves and to be able to communicate with you as their parent. Okay, I went to daycare and so and so changed my underwear, but then they touched my pee pee, my penis in a whatever, like if they're saying pee pee and wee wee and down there, it's like, you want to make sure that your kids have the right words. So
Mm.
it takes practice, but it really takes like checking your own bias, doing your research. There's a great sex educator. She has a website called Sex Positive Families, and she does groups, parenting groups. She has a book. I would highly recommend checking out that website um, for people who are parents and want to you know, do it the right way. And let me see if I can make sure I'm giving people the right resource. It's called Sex Positive Families. And yeah, I always refer people um, to that website. So yeah, but I mean, there's lots of resources in Sex Positive Families. The website also has a list of other resources, so that's a good place to start if you're like, this is overwhelming. I want to have this conversation. One other piece about this is that some girls are even starting their periods at age 8 and 9. So we really can't wait. Especially girls of color, they are having their periods sooner. So we really do need to have the conversation with your kids as soon as you can.
Wow. This is heavy. Look, it's still heavy for me, and I don't know why. I'm an adult. Like, why do you feel like it's so uncomfortable? Why do you feel like people are so uncomfortable with talking about sex?
Yes, there's a lot of reasons because we have been taught that sex is taboo. We've been taught that it's dirty and that it's naughty and that you shouldn't do it. It depends on also your background, right? If you come from a very conservative family or like a very religious family, there's lots of messaging that we get that sex is like something that's bad, when in reality, it's something that most of us do and have to do to reproduce. And also, we also gaslight people and we're like, oh, you should only have sex when you're married, and then but people have sex because it feels good. We have to also acknowledge that people are
Mhm.
doing it, right? So how do we give people the information so that they can do it safely, and also so that they are enjoying it and that they're also doing things that feel good to them, not just physically but also spiritually, mentally, etc. And so the stigma that's around sex, it comes from all over the place. It comes from what we learn from our parents. It comes from what we learn in school, right? So if we look at part of the reason why I started Gorjus Sex Ed is because a lot of these curriculums focus on the negative. If you have sex, you're going to get pregnant. If you have sex, you're going to get an STI. You're going to get chlamydia, and your penis is going to fall off. Like that's what they show you the pictures and the scare tactics. So that's why there's so much shame and stigma around it. But there's a new movement where we're moving towards sex positivity, where we talk about these are normal things that people are doing. How do we empower you with like the language? How do we empower you with the tools that you need to enjoy your sex life, right? And then we also add this additional layer of race and racism, right? Certain people should not be having sex. They are deemed unfit to have children, right? We want to control the population of people, certain people from having more kids. So we're getting that messaging too, right? Like you're unfit to have kids because you don't have blank, 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 blank. So you should be on birth control. You have 5 kids already. You shouldn't have any more kids. That kind of language, we're getting it from all over the place. Our own administration, right?
Mhm.
Wow, because I don't know they listening, but our
Mhm.
government also has been sending us these messages from it's been embedded into the culture of America, and in some cases across the world. So that's the reason why there's so much stigma. Um, And then
Wow.
you see on TV all this suggestive sexual messaging, but then we're getting other messaging that is wrong. So it's like conflicting,
Mm.
very difficult to navigate, especially as a teenager or a kid, because you're like, I thought this was bad. Why is it like all over this movie or all over this show or whatever? So,
That is so true. So, what are some misconceptions that you've noticed that teens have when it comes to sexual health, and how can we kind of clear up those misconceptions?
oh my God, we got all day because there's so many things. There's so many things. I don't even.
Look, give us like three.
I'll say, first of all, the very basics, anatomy. Once
Hmm.
again, people are not learning their body parts. So I
Wow.
have had young people who have never looked at their own genitals. They've never looked down there to say, okay, this is what my vulva looks like. This is normal for me. This is not normal for me. They have no idea that there's three different holes, right? They don't know that the urethra and the vagina and the anus are like separate, right? I had a patient just the other day, and I was like, do you have foreskin? Are you, because he was having urinary symptoms, and he's like, what's that? He didn't even know the difference between
Mm.
circumcised or uncircumcised. So some of this just like basic kind of like, this is anatomy. Like this is literally just biology. This is not political. This is literally just like what the different things are called. The young people have a problem with that sometimes. So they'll be like, "Oh, it itches down there," and I'm like, "Where?" like,
Mm.
and I have, like I said, I have lots of images and diagrams. So I literally will pull it out and be like, "Point, where on this diagram are you having discomfort?"
Wow.
So that's that. Secondly, I would say virginity. There is a lot of misconceptions about virginity. Young people throw around that word. Adults do too. And I always ask people, what does that actually mean? Right? So a lot of people will characterize virginity as not having sex. But what is sex? Right? If someone I'll give you an example. I had a young person, 14. She came to the clinic to see me. This was before I worked at this location. And she was like, I was in a relationship with this boy and it was toxic and I'm so glad that it's over and like we're not together anymore. And I'm just so glad that I'm still a virgin and I let him put it in my butt and I didn't let him put it in my, down there.
Wow.
I had anal sex with him, did not use a condom, but it didn't count because it wasn't in her vagina.
That's what I learned.
Right. So this is what I'm saying. This is problematic though, because she can still get an STI, right?
Mhm.
Anybody can still get an STI, right? So I always tell people any penis and vagina, mouth, anus, contact with anybody else's penis, vagina, mouth, anus, any of that, we need to talk. And I need to test
Mm.
specifically which body parts you're using. So I ask that same exact question to every person. I don't put it past anybody. I don't care what you look like. I don't care your religion. I don't care how old you are. I ask all the teens the same questions because it's important to know which body parts people are using so that we could test the body parts correctly. Because you can have one thing in one place and something else in another place. So yes, it could be very
Wow, and you can't detect it if
if
you
you
test
don't
the
test
wrong
it.
place, right?
Exactly. Yeah,
Wow.
exactly. So a lot of the kids don't think of sex in that way. They're just like, oh, I did it. And I'm like, did what? Like, what specifically were you doing? And how? And that way you can also educate. This is how you protect yourself. Make sure you use a condom. If you're going to do this, and then also testing. You should get tested every year. You should get tested every 3 months. If you have new partners, you should ask your partner to see their test results before you guys have sex. So that way you know. So have to have
Mm.
a lot of education around risk of STIs and things like that. Um, and then the other thing I would say that the kids, a lot of misconceptions, a lot, periods. The girls do not know what is going on. First of all, they don't know the
Mm.
menstrual cycle. They don't know that there's other hormones that are fluctuating throughout the month, and that can be causing them to feel tired or causing them to feel energized or causing them to feel moody, etc. They don't know that how periods are related to pregnancy. They don't know that in the middle of the month, 2 weeks before they have their menstrual cycle, they're ovulating and that they're at risk for pregnancy. There's just this disconnect between like the blood that they're seeing when they have their period and like what else is going on. So that's a huge thing that I often will educate young people about is like what is actually happening and what does this mean? The whole purpose of the menstrual cycle is to get you pregnant. But a lot of young people don't know that. A lot of adults don't know that. But that's what's happening every month. And so by having that information, you can better equip yourself to prevent pregnancy. Because if you know you're ovulating, you avoid sex during that time. And then one
Exactly.
other thing is people don't talk to young people about how to get pregnant, right? We teach them how to not get pregnant. Don't do this, don't do that, don't do this. But what happens when somebody comes of age that they want to have children? They don't have that knowledge base, right? We've only
Mhm.
taught people how not to. We haven't taught them, okay, this is the information you need to know to have a healthy, happy pregnancy when you are ready. So that's part of what I've had to unlearn myself is like I can't just be like, don't get pregnant. I also have to be like, here's information for like how people reproduce because now people are doing egg freezing, people are doing in vitro. There's all these other ways that people are creating families. Young people need to know about that soon, like before, they need to know about that now, not just when they're in their 30s and wanting to start a family. So those are all the things.
Wow. So, wow, this is, I mean, I'm just mind blown because honestly, I'm just like, I literally had that mindset where I'm like, okay, my daughter is young and, I don't have to worry about that right now. I do talk to her about her body parts and maybe I should continue to do that more.
Yeah.
Because, I just want to be on top of it, like you said, to educate and make sure that she's aware because at the end of the day, she is going to be an adult. And we can't really you see it a lot, like you said, in TV images is everywhere,
Yeah.
right?
Yeah.
So I'm like, okay, I need to like change my mindset, and I appreciate this conversation because I'm like, okay, she's not too young. We need to kind of, I need to approach this. So I want to know, how do you approach talking to teens or children about consent and identity and pleasure when it comes to sexual health? I guess.
Yeah. So I think once again, normalizing things. This, kids your age may be like experiencing these type of things. I'm not saying you, I'm just saying there are teens because the kids are like, oh no, I never, never. Like, if you do, if I want you to know that you can come to me, but I'm just telling you this because I want you to have the information so that you can be ready if something like, so always like kind of normalizing it, creating like that safe space from the beginning of like, I'm not here to judge you. I'm literally here. I'm just trying to like give you this information so that way you could be prepared because my parents never told me this. And my parents didn't. I didn't get any sex ed from my parents. My mom was like, you having periods now, you can get pregnant. Here's a pad. Like we
Exactly.
gotta have the talk. We didn't have the talk either about like sexuality or gender or like the type of people I'm interested in. Like some people like boys, some people like girls, some people like both, some people don't know. Like never had any of that. So I would say as much as possible, you just kind of, and I think people are always afraid that, oh, if I talk to my kid about this, I'm introducing this to them. And
Right. It's like
now,
opening up their mind to something that they're not thinking about. That's
but
how I thought about it.
but at the end of the day, they're seeing this already. They're already seeing it on TV. They're already talking about it with their friends. They're already having these conversations. They're already, and then don't forget social media and these games, Roblox and all this other stuff. They're being exposed. So, and if they're not already, they will be. So it's almost like you want to prepare them. You don't want to like overwhelm them and be like, these are all the different things. There's people who are polyamorous and but you do want to like kind of get that, get a head start because also when it comes from you, they're like, okay, this is a person that I trust. This is a person that I love. This is a person who I know is giving me the information that I believe, like it's a credible source versus like them just like kind of figuring it out on their own. So it's never too early to kind of bring these things up. And I think the best way is when it's in these kind of like, these settings or times um that these opportunities arise. So it
Mhm.
doesn't have to be like all right, we're gonna sit down at the kitchen table today and we're gonna talk about, it may be like I said before, you're watching a movie, you're driving in the car, and a lyric comes up, on a song, and you're like, what do you know about that? Like, have you guys talked about that in school? And sometimes you'll be surprised the kids know way more than you think they do. Like, I remember my niece, she is 17 this year, but this was a couple years ago, and she wanted to help me with Gorjus Doc. And I was like, listen, what you talk about with your mom? Because I'm not gonna be the person to be having these conversations with you for the first time, and then I get in trouble with your mom and your dad because I'm being, woke auntie, and like, I want, if it's my own kid, that's different, but someone else's kid, I wanted to be a little bit, So she's like, yeah, we talk about all this stuff all the time. And she was like, and I was just wondering like what your thoughts were on abortion. Because I think that it's a woman's right to choose and blah blah blah. And she starts spewing out all this information, all these policies and laws that she had been reading about. And she knew way more about it than I thought she did. She
Wow.
was way more comfortable talking about this stuff than I was talking to her about it because I was afraid to bring it up to her. But she already heard it. And so I created this space. And it's funny because when I was in medical school and studying, she would always be in all my books and she'd be in my anatomy books and she'd be like, Auntie Tasha, what's that?
Oh,
Like
she went to
it
the beach. You got a little mini me.
would be like the genital, like, images. And I'd be like, that's a penis. Like she would always just flip through my books and be like, Auntie Tasha, what's that? I'm, I'm like, did you talk to your mom about this? I don't want to. And so I understand your discomfort because I, as an auntie, have felt, but you have to create. But now obviously now it's different. Like we have like this open conversation about things, but definitely you got to just rip the band-aid off. And the best way is you have to educate yourself. Like
Mm,
it starts with you feeling confident and comfortable and knowing that what you're teaching your kid is the standard of care, the standard of, the gold standard. If they went to the top school in the country that did all the right things that they were supposed to do, this is what they're supposed to learn. So that gives you that encouragement of like, it's not too soon, it's not too much. Let me like make sure that I'm talking to them. And let them know that they can ask me any questions whenever. And sometimes they may not want to ask you, so you can also do something like you put a little question box, right? They could write on a piece of paper, slip it in there, and then like maybe once a week you guys go through, whatever. Like you could do it in a way that it's like more anonymous, even though they know, it's them, but they may not want to ask you directly.
right.
And sometimes they'll also, like I said, teens are always listening. You think they're not listening, but they're always listening. So you may bring something up, and in the moment they're like, no, no. And then they're like, shut down and I want to talk about it. And you're like, okay, well, when you're ready, just let me know. And
Right.
you'll notice that a couple weeks later, a couple months later, they'll come back to you and they'll talk to you about it. So sometimes you got to just give them the space. You got to breathe, I feel it out. And every kid is different. Some kids are super curious, they want to know everything. And I approach things also from like a kind of like the scientific, like nerdy standpoint, right? Like this is not political. This is science. This is how your body works. This is how STIs work. This is how your menstrual cycle works. Like this is just biology. This is just facts. It's not always there's no um like morality attached to this information I'm telling you. It's literally information. So you can look at it from that standpoint too.
I love that. I really wish that I was more informed as a teen. Cause I'm like, I mean, a lot of these decisions that I was making, I could have bypassed all of that. Okay. If I would have just had a little bit of information, like just a little bit of education, it would have helped. And so I know, that now social media, everybody knows, but social media is like a big thing now. Like
Yeah.
social
Yeah.
media, I mean, you could get on the internet and see anything, right?
Mm-hmm.
So
Yep.
how, what can we do, or how do you, I guess, like how do we protect teens from
Yeah.
harmful information? Like how do we distinguish between information that we need to know that's important to educate ourselves and harmful information?
Yes. This is a big thing I always talk about because when I first started doing social media back in 2020, a lot of my colleagues, a lot of like doctors were like, oh, like we shouldn't be on social media. And like, what if your patients find you and blah, blah, blah. And I'm like, I want them to find me because that's where they are. The teens are on social media. They're not going anywhere. And they're going to just move from one social media site to another. So they're going to move from Instagram to TikTok. And then when TikTok fades and something else, they're going to move to something else. It's never going to end. They're always going to be in these kind of virtual social spaces with each other. So my goal as a doctor and an educator is to infiltrate those areas and add correct factual information, right? So that's how I look at it from a professional standpoint. The other thing I would say is providing teens with the tools to be able to decipher what is real, what is not, and what is credible and what is not. Those are important skills, especially in this current society with AI and the way that people are photoshopping things and, editing videos and things like that. You could see stuff online and think that for certain this is true. But you have to teach people, young people, how to be discerning and how to, analyze what it is that they're taking in. So I always tell my young people, what you see on social media is not always real. That person who lost 30 pounds drinking tummy teas, first of all, are they selling those tummy teas? They're trying to make money. Okay. Like, and can't believe everything you see, you know? So very important to educate the young people about that. When it comes to sexual health stuff, I always tell them credible sources are doctors. And when I say doctors, I mean you go and you look and you see, where do they work? Do they have a degree? What is that degree? Where do you need to, like, sometimes even fact check those, because there are some crazy people out there who are claiming to have degrees that they don't have. So when you watch that video, who is doing this video? What's their credibility? What other videos do they have? Are their videos balanced? Are they giving you balanced information, or are they just giving you like scare tactics, like don't do this, don't do that, blah, blah, blah. So kind of like analyzing what it is that they're telling you. And then also backing up whatever it is that they said, finding the source of maybe where that information is coming from. So if people say things like, for instance, birth control makes you gain weight, where are they getting that data? Where is the research study to show that thing that somebody may have said online? And to be fair, sometimes there is no direct correlation where you could just be like, oh, there's a paper that directly, but I challenge young people to do their own research. You hear something online, don't just believe everything you hear online. Look it up, do your own research, and then talk to a trusted adult. So I have a lot of kids that'll come to me and they'll be like, I saw this thing on TikTok. Is that true? And I'm like, no. And they're like, see, I knew it. That's why I asked you. And I'm like, great, So it's important to have, a trusted adult that you can like then vet this information or vet the, social media stuff with as well. Parents are a great source for that too. So if you notice your kid is watching something on TikTok or Instagram and you're like, that doesn't sound right, you could bring it up and have that conversation, use it as a spring point to do some teaching. So it's really hard. The kids are overwhelmed. Like back in the day, we didn't have enough information. Now they have too much information and they have to
Right.
decipher what is real, what is not, what is true, what is not. But I've always encouraged young people to question everything. I always tell them, question everything, even question me. I might say something to you, and maybe, how do you know I'm telling the truth too? Question me too, So I always tell them, stay woke.
Must say that right. Wow, I just love this. So I know I have like a few more. I have a few more questions. I know we have to kind of wrap it up, but I'm just really enjoying this conversation. I felt like I really needed this conversation, especially as a parent. I feel like maybe you need to have a parent session. You get some parents together and teach these parents,
Yeah.
especially homeschooling parents, because I'm a homeschooling parent, and so the children that I work with are homeschooling parents now. I'm no longer a teacher. I work with homeschooling parents, and so these children, they don't get it. They don't get exposed to a lot like they would in a public school, right?
Right,
So I think that sometimes parents are not thinking about that, but it's
right.
still so very important. So I'm glad to have this conversation with you. I feel like I have like two more questions if we can just do two more.
Well, before we get to the next question, I just also wanted to plug another really good resource, amaze.org. I don't know if you have used that website, but it's amaze, like AMAZE.org. And they have a section for parents and they have a junior. So like for the younger kids, and then they have like the older kids. And they talk about all these different sexual health topics. They talk about like body odor and abortion and like self-harm, and like they just do it in a very nuanced like animated way. So I would recommend those resources as well. Because they kind of do it in a fun way. So obviously you might want to watch it and vet it before you show it to your kids. But that's a good supplemental resource for people who are homeschooling and want somewhere to kind of like start.
Okay, awesome. Thank you for that. And I'll definitely try to put the links in the video descriptions, all the links that you mentioned, because I want parents to have those resources. Um, I would love to kind of maybe look at the education side of this and talk about like what changes do you wish to see when it comes to sex education in schools?
Yes. Oh God, where do I even start? First of all, there needs to be a federal mandate for
Mm.
sex ed. Right now, it's state by state. Every state can do what they want, and there's no consistency in what is offered. And then the other thing is there's a lot of focus on the negative, a lot of focus, like I said, on pregnancy and STI prevention, but there's not a lot of focus on like those softer skills like communicating, boundaries, relationships, like those other, important skill sets, because you can have all the knowledge about like, okay, if I don't wear a condom, I can get an STI. But if you don't have like the skill set to negotiate with your partner, okay, you know, I I don't feel comfortable having sex without a condom, you're still going to end up in that situation. So I wish that there was more resources, and I'm guilty of this too. As a sex educator, it's easier to focus on like the anatomy and the this and this and this and that, but there needs to be this additional piece of like those softer skills and like being able the role playing of how to like work through those situations. Um, so those are the main two things I would say. And then the third thing, which is kind of crazy, is medical accuracy. So it's actually not mandated for it to be medically accurate. There's only about 20, I think 30 states that require the information to be medically accurate. So people could just make a curriculum and be like, say whatever. Yes, I know, crazy. And then the other thing is representation. I I had to create the resources that I wanted, but
Mhm.
I just wish that they already existed and that people of color, people with different body types, people who are disabled, people who speak different languages felt seen and heard in their curriculums that they receive in school too. So that's why I do what I do.
Wow. Wow, I'm just so amazed. I know that you said you've been doing gorgeous doc for 5 years. So before we go and kind of wrap it up, I would love for you to just talk about your entrepreneurial journey. Like how's that going for you? Like
Yes. It has been so interesting. So as a doctor, my career has been very much like a treadmill. Like I got on it and then you just like keep going. You keep going. There's like different milestones. Everything is kind of preset for you. Like you know what you need to do and what you need to accomplish. There's all these tests you need to take. Entrepreneurship is not like that. It is very much up and down, round and round, a fork in the road. You go one way, you go backwards, you stop, you start, you go slow, you speed up. Like it's just not predictable in that way. And I had to learn to like let that go. I had to
mm,
learn to just be like, just roll with it. And I had to learn that the I'm never going to be able to predict things. I have to just give my customer base and people I work with what they need. And the only way I'm going to know that is by communicating and continuing to work with them. So I've learned so much from my community, like my community of educators. They have pushed me to be better. They have pushed me to create new things that I never would have created. They keep me accountable. So it's just a continuous learning process. And for me, because my full-time job is being a doctor and this is my side hustle, it's not even just a side hustle, it's my life's work. So I don't feel like this need to like rush it. I'm like, I'm gonna take
Mm.
my time and I'm just gonna chug away and I'm just gonna keep building and building and building and building. And this is not, I'm some people when they start a business, their goal is to create it and then sell it. This belongs to me. After
Mm.
that, I don't want nobody to have a piece. I'm not about to get venture capitalists to no. This is mine. I don't
Yeah.
I have to bootstrap this for the rest of my life. This is mine and it belongs to me, you know? So there's certain like morality I have around it too. Like I'm not gonna put ads on my website. Like I don't want people to be bombarded with all this stuff. Like there's just certain things like I'm not gonna be advertising people's products. Like this is my passion, you know? So yeah, I mean, entrepreneurship is a journey and it is not for the weak. You almost gotta be delusional. You almost gotta be like, I had to manifest things. I'm like, you know what? I'm gonna be working internationally. I'm gonna be traveling the world doing Gorgeous Doc. And I do, you know? So it's like you just have to like make it happen. So for all those people who are listening to this and you have an idea, just do it. You can't, it's never going to be perfect. And even when you think it's perfect, the population that you're working with is going to tell you otherwise, and they're going to have to change it. It's an iterative process. You're constantly going to be changing and growing and changing. My website, I have edited it 5 times. Right now, Gorgeous Doc, I also call it Gorgeous Sex Ed. And the next year, it may be Gorgeous Health Ed. Who knows? So you just got to keep going with the flow, you know? So yeah, that's my entrepreneurial journey.
I love that so much because honestly, I started entrepreneurship in 2019, but I still had a job. But like I'm full. And what you said, like I'm not working anymore at this point. And like being an entrepreneur right now is different from when I was being an entrepreneur working.
Yes.
It's so different. Like you said, it's so unpredictable, right? But
There's
I
way too
love
many
what you
resources now. It's so much stuff now. Now you back in the day, I used to have to be doing stuff, and now there's AI. I could just chat GPT stuff. It's just crazy. Like you just never know what's gonna happen.
You never know, but I love what you said about this is mine's and I can take it as slow as I want to go to make sure that I'm creating what I truly want to create.
Yep.
That I don't think anybody has ever. I love that advice. I don't think I've heard it that way. Like, yes, if you have like, yeah, I love that. Like the ad, like all those things you think about that. Like, should I be running ads? Should I be doing? No, like if it's yours and you like, we're gonna have to bootstrap it. I'm with you.
Yep.
Okay.
Day by day, brick by brick, and it's going to be nice and sturdy. I'm not about to just be, doing things all willy-nilly just so I could keep up. And you have to remember your journey is your journey. You're
Mm.
going to have competitors, right? There's going to be people that are in the same market as you, doing the same thing as you, but they're not you. They don't got your sauce. So you just stick to your plan. You got to stay on your journey. You don't compare your journey to anybody else's journey. That's it.
Amen. I love that. So now that we are wrapping it up, what is a takeaway or what do you hope that young people will get from your work?
I hope that young people feel empowered. I want young people to feel empowered, even if they don't remember a thing that I said. Like, I want you to be empowered. I want you to ask questions. I want you to feel like, you have the tools to do whatever it is that feels best for you. So that's the main thing I want young people to get. The information, like all that stuff, you can look that up anytime. But I want you to feel empowered. I want young people to feel like, you know what? I can go to my doctor and I can ask them for what I need. I can go to my partner and I can tell them I don't feel comfortable with that. I can go to my parent and tell them that I'm not comfortable with them talking about my body that way. Like I want, or my auntie, whoever, at the Thanksgiving dinner, whatever. I want young people to be empowered. So that's what I do it for.
Wow, there you have it, you all. Can I call you doctor? Look, I just have to call you doctor. I know you said you like to be called Tasha, Natasha, but Dr. Natasha, she gave it to us real raw, especially as parents. We need to hear this. So hopefully you checked in, you watched the whole video. Don't skip over. If you skip, go back Okay, because you
Save
might
it for
have missed.
later, right?
Save it for later because you don't want to miss this information, you all. This was just a beautiful conversation about teens, sexual health, empowerment, consent. Like those things are so important. I'm so glad that you're doing this work. Thank
Thank
you
you
so
so much.
much. Where can we find you at? Give us your links and stuff.
Yeah, so my website is www.gorjusdoc .com. And then my email is the same thing, gorgeousdoc@gmail. My Instagram, if you want to see me go to the gym and go to brunch, is gorgeousdoc. But if you want to engage in just the sex ed content, is gorgeous_sex ed. I'm also on TikTok, but still working on that. But also gorgeous_sex ed on TikTok. So yeah, if you have questions or you like this, podcast, like feel free to follow me. You can DM me. It's me managing it, so I will respond. Just one a solopreneur at this point. But yes, feel free, follow me, connect with me. If you know other people doing this work, connect me. I love talking to other people doing this work. So yeah, that's my info.
Well, there you have it, you all. And don't forget to like and subscribe. And I will see you on the next video. Peace.